good morning or good afternoon, wherever you are. So, as Ellie mentioned, my name is Patrick Ashley. I'm one of the senior deputy directors at DC Health, located in Washington, DC. And I know a lot of our conversation today is about rural America. And so you might ask, why is the city of Washington, DC here with 700,000 individuals? And a lot of we're struggling with a lot of the same problems, here in DC as rural America. Although we do see in rural America that some of those are amplified by distance and resource limitations. And so, we're here to collaborate and talk about these issues together. As some of the previous comments were, I want to highlight just the fact about the importance of vaccination going into the holiday seasons. What we see here in Washington, D.C. is that 97% of our hospital admissions are individuals who are unvaccinated. Candidly, we see individuals that are vaccinated who become sick. About 20% of our cases are from individuals that are vaccinated. But the key point here is that they're not ending up in the hospital, that they are not ending up on a ventilator, and most importantly, they're not dying. And so, we want to encourage individuals to get vaccinated. And some of the recent comments we've had with the holiday seasons coming up is, I don't have enough time to get vaccinated before Thanksgiving. And that's correct, right? There is, only a few weeks left till Thanksgiving. But what we want to talk about is the fact that any protection is good protection. And we talk about layered mitigation. And so if we can get individuals in to get vaccinated today, whether that's Moderna, Pfizer, Johnson & Johnson, it provides some level of protection. The other comment I want to talk about as well is mask wearing and that layered protection. One of the things we see here, and I see with my own family, I experienced this during the pandemic, is we take comfort with our families and friends. And so that means that we sort of let care go to the wayside and say, I'm gonna hug mom. I haven't seen mom. I live 150 miles away from my parents. And so I haven't seen, I don't see them but every 6 months or so, especially during the pandemic. And so I forget about my mask, right? I forget about the fact that maybe I have the sniffles, and, I'm so, interested in seeing my parents and seeing my nephew and my brothers, that I forget that, we still need to do what's right in the world, and that if we're feeling sick, to stay home and to do that virtual Thanksgiving. That's so important as we go into the holidays, because it's not just about protecting me and preventing me from getting COVID. It's also about protecting my grandparents, protecting my nephew, protecting my parents as well. And it's the entire community that we want to make sure we protect. So I'm looking forward to the conversation here. I'm definitely passionate about testing. We do a lot of testing here in DC. I'm passionate about getting people vaccinated. And, the federal government provides tons of money to be able to do testing. And so we hear sometimes that there aren't resources, but there's plenty of federal money out there to get resources. We just have to be creative about how we get it. So happy to be here and participate. Yeah, thanks, and I appreciate the conversation so far. I think we talked a lot about access here, and coming from a urban area, I want to tell you that access is not the be-all end-all. We have more than 200 vaccination locations in the city, and we have 63 square miles, right? We have within a 20-minute walk of 97% of the population, you can get a vaccine in DC. Yet we still see east of the river, we have a very disproportionately more economically challenged population in a part of our city. And we see that vaccination rates there can be 30 and 40%, where the rest of the city is 80+%. And so it's not necessarily just about access, right? It is about the conversations that we just talked about. And I want to point back to, we had lagging vaccination rates in our Hispanic and Black community here in DC. And we still see lagging vaccination rates in our Black community. But what we saw amongst the Hispanic population is there were local champions that said, you know what, we're going to get this population vaccinated and we're going to protect ourselves. And we saw these lagging indicators. And all of a sudden, we saw the Hispanic vaccination rate surge, because there were community champions that were having those conversations. And it wasn't Patrick getting on television talking about it. It wasn't my boss or the mayor getting on television talking about it, but it was people that they trusted. And they didn't have to be doctors. They didn't have to be nurses, that they were people that said, just like we talked about, that I did this for my health, and this is why we need you to do this as a community. And so I agree, it's not this one sort of be all end all conversation that suddenly somebody's going to go, yep, sign me up to get vaccinated. And a point that, we've struggled with here is that a lot of people have really dug in deeply about not getting vaccinated, and it's become somewhat of a sense of personal pride. They don't want to be seen at the CVS getting a vaccine because they have said, no way in hell am I going to get vaccinated, right? And so all their friends know that. And so even if they change their mind, right, that personal pride prevents them from getting vaccinated. It's somewhat of a shame, right? And so, what we've tried to do here is provide another form of access, and that's to be able to do vaccines in their house. You call a phone number and say, I want to get vaccinated. We don't care why. It might be that you have childcare issues. It might be that you have mobility challenge issues. It might just be that you don't want people to see you getting vaccinated. And that's okay. We don't ask why. We show up to your house and we provide your vaccine, your first shot, your second shot, your booster, whatever you want. And so we know that, again, those conversations definitely, are so important. But we also have to remember that people have really sort of created an identity around anti-masking, anti-vaccine. And so we need those community champions, and we need to recognize that we're all humans, right? And nobody wants to admit that they're wrong. And so I just want to make sure that we keep that sort of human element here in the back of our mind as we talk about these conversations.